VIMGRACE Company welcomes you to our conference. As I mentioned earlier, I have 28 years of experience working in a neurology department, which has given me expertise in strokes, which are among the top cardiovascular conditions and tend to remain prevalent over time. In 2022, there were approximately 460 cases of stroke recorded in the Russian Federation, with nearly 5–10% of those cases affecting individuals under the age of 45. This means that young people are not immune to this condition, which can result in serious consequences. Young people are more prone to hemorrhagic strokes, which are often caused by aneurysms or vascular malformations, while hypertension and atherosclerosis are common causes of ischemic strokes among elderly individuals. The symptoms of stroke can vary depending on the location and severity of the condition. We often overlook our own health and ignore symptoms, but they can lead to complications, more serious health issues, or mental stress. Young people with hemorrhagic strokes can experience symptoms similar to those of migraines. Therefore, if a doctor makes this diagnosis, it is important to pay attention to one's health and undergo thorough examination. This may indicate the presence of undetected aneurysms, which can be primarily determined by genetics and can occur at any time. The symptoms may also be caused by pathological changes in blood vessels, called malformations. It is vital, therefore, that young people suffering from migraines are examined and treated by specialists to prevent serious complications such as disabilities and even death. With regard to ischemic strokes, these are more common in young people and can be caused by trauma or conditions such as rheumatic diseases, cardiac arrhythmias such as fibrillation and hypertension or hypothyroidism. It is evident that, in addition to medical conditions, injuries are quite common, especially in the winter season when there is a risk of slipping and hitting one's head. These injuries can lead to tension in the vascular wall. As mentioned earlier, the bones of the skull that protect the brain have arterial grooves on the inner surface, and injuries can cause these vessels to rupture, which can lead to a stroke. It is important for those who suffer a head injury to pay special attention to their health and to seek medical attention to exclude any complications. In the case of blows, even mild ones, the bones of the skull remain intact. However, in the case of severe trauma, shockwaves can lead to detachment of the inner general plates, also known as the vitreous substance of the skull bones. This can lead to vessel rupture, perforation of the vascular wall, and even slow hemorrhages in these arterial vessels. Recovery from these injuries is very difficult and can lead to the development of intracranial hematomas, increased pressure in certain areas of the brain, and of course, more serious vessel injuries and bleedings. Therefore, in case of head injuries, it is crucial to undergo adequate examinations. Often, people do not pay attention to minor issues that could have major effects on their health, such as strong blows to the neck area due to sudden braking of buses or minor traffic accidents. These can lead to relaxation or rupture of the aortic wall, which can lead to the formation of aneurysms and, consequently, to the possibility of the vessels rupturing. Eventually, even after years, this can lead to the rupture of the vascular wall and the occurrence of hemorrhagic strokes. It is important to pay attention to sudden and severe headaches that spread to the arms, especially in young people, as they can indicate an aneurysm rupture. In this case, there is pressure on the brain, and neurological symptoms may appear with irreversible consequences. In such a situation, urgent medical help is necessary. The main symptoms of a stroke include unstable blood pressure, most commonly high blood pressure. In case of an unjustified increase in blood pressure, symptoms such as sudden and rapid weakness in the arms and legs, speech or vision disorders appear. It is important for people with hereditary predispositions to pay attention to warning signs. Hereditary predisposition exists in both men and women, and factors that can lead to strokes include especially the enzyme homocysteine in men and the Leiden mutation in women. Therefore, it is important to undergo genetic testing if these have occurred in previous generations. Each person must know about their own inheritance, especially young people, as it can be passed down to the next generation and can have serious consequences between the ages of 45–60. Overweight children may be more susceptible to strokes due to early-onset malignant hypertension. Additionally, antiphospholipid syndrome can be a hereditary predisposition that increases the risk of stroke. To prevent strokes, it is important to avoid taking psychostimulants without consulting a doctor, as these can increase vascular tone and be dangerous to health. Even though there are innovative treatments available for strokes, the mortality rate for hemorrhagic strokes remains high. It is important to seek prompt and appropriate treatment, but not all cities have specialized centers for this issue. In old age, the ventricles of the brain are spaces extruded through the vasculature that participate in the formation of cerebrospinal fluid and circulate through the subarachnoid space. In addition, cisterns are additional cavities that allow the enlargement of the subarachnoid volume without exerting pressure on blood vessels. Degeneration of brain structures and cortical substance leads to an increase in subarachnoid volume, so even if a significant amount of fluid is removed, there is unlikely to be a serious brain injury. However, extended care and treatment are required. In young people, the regeneration of brain structures occurs more rapidly due to a higher number of stem cells present at the cerebral level. However, cerebrovascular accidents are more severe in young people and require early care. If treatment is offered in a timely manner, recovery is much easier and brain structures are able to fully recover within a period of 5 or 6 years. Individuals between the ages of 45 and 60 are vulnerable and difficult to treat, as cerebral plasticity decreases and degeneration of brain structures limits the ability to compensate for the loss of brain fluid. It is important to understand that we cannot make precise predictions in such cases of stroke. Each person may present different symptoms, such as speech impairment, as heard in Algia's feedback today. Typically, when a stroke affects the left hemisphere of the brain, for example, via damage to the left coronary artery, a significant speech impairment occurs. These disorders are usually more common in right-handed people than in left-handed people. If thrombosis occurs in the blood vessels of the right hemisphere, patients experience problems with physical activity, such as weakness in muscle tone, but speech impairment symptoms are not observed. Patients are able to carry on conversations if they are conscious and respond appropriately to questions, but there is a decrease in emotional and volitional qualities, related to the brain area that manages those qualities. They are more prone to post-stroke depression and may become capricious, refusing to take care of themselves. Practically, this syndrome of emotional and volitional quality disorder predominates in stroke patients. In any type of stroke, there is a complication of loss of movement. For example, Oleg today was unable to use his hand to pick up objects, although it was simply hanging. Additionally, facial asymmetry may occur, which can persist for a long time. If language centers are affected, there may be a change in speech, such as difficulty in expressing words or a disruption in words. Furthermore, we have observed that patients may be frustrated and, at a subconscious level, may use obscene words, although they are unable to speak any other word adequately. Many patients who suffer from stroke not only have difficulty generating or constructing sentences, but also in perceiving sounds and words, leading to the appearance of aphasia syndrome. Often, these patients do not understand the speech addressed to them, which makes their daily life difficult. They cannot decipher the flow of words and feel uncomfortable with what they are told. This creates additional pressure for the nervous system of those around them, who must compensate for this issue. Although it is common for epilepsy to appear as a complication after stroke, this is because when a lesion affects a certain area of the brain, spikes may occur that can lead to areas of hyperactivity in the motor cortex of the brain. In most cases, previous strokes are not related to the onset of Alzheimer's disease. Regardless of the cause of the stroke, ischemic or hemorrhagic, cardiovascular health is key to reducing the risk of this type of stroke. Numerous studies have shown that this therapy can reduce the risk of stroke by 43% in individuals with a high genetic risk for this condition, if the doctor's recommendations are followed and a healthy lifestyle is maintained. Maintaining a healthy lifestyle and taking preventive measures, such as consuming our ACTIVIDAN, which contains S-monosaccharides and 6-deoxygalactoses, can significantly reduce the risk of stroke and even delay the onset of this condition by more than 6 years. Research has also demonstrated the effectiveness of this food product and its benefits for maintaining cellular health and eliminating toxins. During a stroke, cells can be destroyed by enzymes that contain toxic substances, requiring their removal by macrophage glial cells, responsible for cleaning the necrosis area and stimulating the rapid regeneration of damaged cells. By consuming our ACTIVIDAN, which crosses the blood-brain barrier and reaches the nerve cells at the brain level, we promote their optimal functioning and rapid regeneration of damaged cells, supporting the stabilization of membranes and tissues and stimulating the apoptosis of injured cells. Brain stem cells are involved in regenerating and recovering lost functions after a stroke, yielding good results. Among stroke cases, the majority are ischemic, a condition which is intensively studied. Thrombolysis is the main treatment for ischemic stroke, and early intervention in this procedure improves the prognosis. Thus, patients with specific symptoms should be transported to specialized hospitals within 4-5 hours to reduce the risk of complications and prevent the death of important brain cells, with minimal damage and efficient recovery and rehabilitation processes. Discussing thrombolysis essentially refers to an activity we are all familiar with, and the state of our blood vessels affects our entire body and health in all discussed conditions. Essentially, restoring adequate blood flow is crucial in treating any disease, but especially ischemic stroke, and is key to successful recovery of functions. The first study of the over 2,000 studies on vascular pathology that I have previously mentioned took place in Russia. 13 years ago, the Russians demonstrated the efficacy of ACTIVIDAN, even in the absence of complete knowledge of its composition, which is still under research, and we are increasingly understanding its impact on the body. This is the first study which demonstrated that 6-deoxychiroinositol, the component of ACTIVIDAN, is chemically very similar to our endogenous heparin, produced in the body. But our ACTIVIDAN is over 10 times more active. Moreover, chemical analogues of heparin are synthetically obtained, unlike all thrombolytics used in the treatment of vascular pathology, including ischemic stroke. It is important to note that all drugs used in thrombolysis have a dual effect, with the potential to cause disseminated intravascular coagulation or diabetic ketoacidosis, which can turn an ischemic stroke into a hemorrhagic stroke, worsening the patient's condition and even leading to death. Therefore, in case of increasing symptoms where it is not known whether the stroke is hemorrhagic or ischemic, it is important to use a minimum dose of ACTIVIDAN, developed at 10 mg per kilogram of body weight, to effectively extend the treatment window. In such acute situations, when the first symptoms of a stroke appear, I recommend taking at least 2 sachets within 15-20 minutes and another 2 sachets within an hour, each sachet every 15 minutes, to maximize the treatment effects. It is essential to seek specialized medical services in the case of a stroke, as treatment will not begin immediately. The patient will first have to undergo a series of tests and a brain MRI, so even if the ambulance arrives quickly, this process can take around 4 or 5 hours before the patient receives qualified medical care. During transport to the hospital, the patient may receive heparin or, in severe cases, a drip. It is important not to hesitate to administer sublingual ACTIVIDAN to the patient, especially if they have lost consciousness completely. ACTIVIDAN is rapidly absorbed by the body even when administered via the oral mucosa, so don't worry if it begins to flow from the mouth, as it will be absorbed by the body. It is important to always have ACTIVIDAN on hand and administer it to closest family members in the event of a stroke. If the patient is on a liquid diet, you can dilute ACTIVIDAN in juices or other beverages and, after being discharged from the hospital, you can help them recover by feeding them, caring for them, and showing affection. Recovery can be much faster with the help of ACTIVIDAN. There is no panacea for all diseases, but consuming ACTIVIDAN can be an excellent aid in maintaining an optimal physiological state of our body. In general, it is important to care for the body with increased attention, prevent fatal intoxication, and prolong life by adopting a healthy lifestyle, proper nutrition, and adequate fluid consumption. Recovery can be much faster with the help of ACTIVIDAN. There is no panacea for all diseases, but consuming ACTIVIDAN can be an excellent aid in maintaining an optimal physiological state of our body. In general, it is important to care for the body with increased attention, prevent fatal intoxication, and prolong life by adopting a healthy lifestyle, proper nutrition, and adequate fluid consumption.